Hello everyone. In today's video, I would like to compare two scans for before and after direct sinus lift procedure. So as you can see, this patient is missing several teeth in the posterior left maxilla. Look at the sagittal view, and we see that all molars are missing and the height of the ridge is very short, as you can tell. Additionally, there is this dome-shaped radial opacity, which is consistent with the mucus retention pseudocyst. Anyway, let's again verify this height of the ridge in this coronal section. So let me go from this premolar and move distally. And again, the height of the ridge is remarkably short, right? So under 3 millimeter, just at that location. And I would say this is even thinner. Simply, this type of ridge would not be would not be a good candidate for receiving dental implants, right? So our resident completed a direct sinus lift procedure, and I want to show you a scan that is taken about 5 to 6 months later from this one. So here we go. We actually took the patient's right maxilla as well because this patient is planned for some other implants in the anterior maxilla. But let's focus this left posterior maxilla that we looked at earlier. So you ready to see the changes? All right, why don't I share the sagittal view first? So pay close attention to what happened to the ridge after the surgery. So this heterogeneous opacities are consistent with graft material, and it has healed and remodeled normally such that I don't see a clear, distinct radiolucent line that would suggest that this may be failing, but I don't see that. So again, that means it has healed just fine. Also, from this coronal view, you can see the window that the resident has created in order to lift up the membrane and pretty much pack this grafted material as much as it could. So now we just went from somewhere from 2 millimeter of the height of the ridge to um, 20 millimeters. So that's a lot of bone, right? So with this type of ridge, I mean, you can just about fit in almost all types of dental implants that you can think of. So we effectively gained 18, close to 18 millimeters of the height of the bone at its highest point. So very impressive and very remarkable. And then surgery has gone extremely well for this patient. I have seen other cases where it failed to integrate all the way, and there were some parts that uh, were kind of fragmenting away from the rest of the graft material. But in this case, this is a ideal outcome of the surgery that we can hope for. So excellent job. And another thing that I noticed incidentally is that the mucus retention pseudocyst that we saw previously is no longer present. So I don't know whether it just kind of healed spontaneously on its own after this grafting procedure, or whether that mucus retention pseudocyst was perhaps removed at the time of surgery, which I do not know about. But in general, they don't try to remove any of those, but simply lift those up. So I think in this case, just doing the surgery somehow allowed the mucus retention pseudocyst to resolve on its own. Whereas if you look at the unaffected side, which I did not really draw your attention to from previous video, you'll just have to take my word for it that there is a mucus retention pseudocyst once again on the right maxillary sinus that is unchanged from the prior study or prior scan. and there is that apical radiolucency of endodontically treated tooth as well. But that wasn't the main point that I wanted to discuss, but mostly just wanted to go over how a successful outcome of direct sinus lift would appear on cone CT. So this is excellent, and I'm really happy for the patient and our resident who performed this surgery. So thank you very much, and I'll see you in the next video. Take care.